I got a black ski mask, but I don't ski, but I snowboard. Dash an MC off piece. If one of you try buy.
Lovely.
Alright.
So right now we are sitting here in Indranagar.
I can't believe it.
Indranagar where?
Indranagar where? We are at this lovely cafe called Paper and Pie.
Yep, we're exploiting.
Yeah, we're exploiting. Cheers, guys. I mean, this is free, but
We've come far.
Our drinks are coming.
yeah, it's all
Anything free
the
is
way.
always good.
Yeah.
Oh, God,
Yeah.
yeah.
So we're here for the first time with somebody who has something to say.
Yes.
No offense, guys.
All the
the
We've
guests.
had so many guests.
So many guests. I'm playing.
But this is like someone who's professional. Who
Yeah,
knows
I'm
her stuff.
nervous, dude. Like
Yeah,
my
who
toes
knows
and
her
all are
stuff.
sweating.
I
But
feel like
I'm
I'm in an
nervous too.
exam.
yeah, we have Dr.
I'm
Kar-
new to podcasts, so
Is this
Is
a
this your
first
first
Yeah.
podcast?
no, this is my third.
Ah,
I just
that's
20.
a-
What's the
I
exclusivity?
just
bro?
started
Yeah.
a few months back, so yeah,
Where
I'm
have
still
you been?
getting
Where
a
have you
hang.
been?
So we did a Josh Talks
Okay.
Okay.
podcast, and then is the Mahua show,
Mm-hmm.
but that was just like an online, more like
Okay.
Okay, like an
thing.
online
But Josh
interview
Talks,
thing.
we were in Delhi at their studio.
Okay.
So again, this is like the second time I'm like in a studio kind of a podcast.
Oh, okay,
So,
This is our first time here as well. So
and
we're
for
all
doctors, this is new to us.
yeah.
So it's interesting.
Yeah.
So where have you are you from Bangalore or?
Yes, I'm from Bangalore,
Okay,
and
right.
I've been here now 20 years.
Mm.
But was born, brought up in Bombay.
Okay.
And had my childhood and
Right.
schooling and my PUC
Mhm.
till Bombay, till I joined med school.
Okay.
We're
For
getting
which I
food
came
and
to
shit.
Karnataka.
Food and stuff,
Yeah,
guys.
This
This is how it goes.
this is so different. You know?
Yeah, this is very-
Yeah, for you guys.
Yeah,
so
yeah.
it's
What is that?
Ice
Yeah,
Ice
that's mine.
Americano.
That's mine. Whoa, who would have thought
You can tell.
me?
A perfect Sunday afternoon.
Yeah, with no sugar because it's day 42.
How do you react to caffeine? I just want to know because like I.
Yeah, 'cause-
Caffeine is
Yeah.
my first thing in the morning.
For real?
I can't start
can't
my
function
day
without
without
so,
caffeine.
so for me
A
personally,
black coffee is what is needed to start my day.
Right.
you take like black, like nothing.
Yes, so this is like obviously because the whole health and calories. It's been 2 years since I stopped milk. And
But
my
then milk is
nutrition,
good,
because I
right?
like my whipped coffee with the milk and all that.
Okay.
Is it
And
milk,
then-
milk good?
See, lactose is an enzyme which we digest milk and,
Oh,
and
it's
then
all
by
right.
the time
Enzymes.
by the time you are 18, that's why they
Right.
say there's no point. So milk really never metabolizes in in
What
the
about
body.
like the calcium for your bones and stuff?
Pop a pill or take supplement.
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 Just
Okay,
in milk
so-
is irrelevant.
So doctor
No, so
came.
actually, so this whole idea, when people are saying gluten free and lactose free,
Okay.
it's well known by us since a very long time in medicine that after 17, 18, the enzyme lactose disappears from our
No,
system.
that's
from our,
crazy.
So that is why the milk really it doesn't work. There's no point. And till I joined med school, I was a crazy milkaholic.
No, I can't
I
believe
love
this.
milk. I love my Bonvita. And then we learned it, so we stopped and we loved our coffee with milk. But when this whole trend came, and we also as doctors, many of us switched and be like, yeah, actually lactose not there. So that's why many people don't. It doesn't suit them, lactose. It's not like something new. It's always been around.
We're 5 minutes and I'm blown.
I'm blown away.
Yeah,
Bro,
yeah.
one second. So you're telling me that after I'm 18 years old,
I mean,
drinking milk
yeah,
doesn't
during
make
that
sense.
puberty years, as you're 18, 21, the lactose enzyme tends to go from the
So I have a year of milk left in me.
digestive systems.
Yeah.
So,
I never really understood the point of milk.
so you
like,
rather
growing
have
up.
curd, yogurt,
Okay.
which is a fermented form,
Hmm.
which is digested and more
Okay.
Bro, we can't have
better.
milk, bro.
Okay, but like.
No, you can have milk.
She's
but
milk drinking milk.
There's no point in it.
but there are a lot of people who realize, right, as
Yeah.
adulthood that they are bloating when they have milk
Okay,
and things,
right.
and that's the whole idea of lactose-free milk coming and
Huh.
almond milk and soy milk substitutes, because for many years people didn't know and why they were having digestive issues, and then now suddenly somebody came out and made it popular, and it's true because the lactose enzyme in most adults are not present.
I feel like the audience still hasn't been introduced yet. So
Yeah. By the way.
Okay.
This is a good intro to
They
who
may
you are.
suddenly think which doctor I am, but I'm totally talking away from what I actually do.
yeah. We have Dr. Karishma
Yeah,
here.
Dr. Karishma, please introduce
Please
yourself.
introduce
Yes.
yourself.
So I'm Dr. Karishma Kagod, and I'm a board certified.
But what's your middle
plastic-
name?
Karishma Timmappa Kagod.
Oh, there's the
Kannadiga.
Huh?
Kannadiga.
Yeah,
Bro,
absolute
come on,
Kannadiga.
come on.
From Sagar.
Lovely.
My
Okay.
dad is Kagod Timmappa,
Right.
an ex
Okay.
minister, ex speaker of the Karnataka Legislative
Bro, I'm
Assembly.
sorry for dissing
And
the
I
name.
carry that liability on my shoulders.
Right.
But away from politics, I'm totally the
Right.
opposite.
But one day.
Sorry?
One day.
One day.
One day.
No.
Never.
Oh my God.
No, but I feel
Politics
like-
is not my game.
Mhm.
Yeah.
But I feel like becoming a doctor, I think, kind of like substitutes all the parents' pressure because you are a doctor, right?
Yeah, I'm a first generation doctor in
Okay.
my family.
So
So,
the only doctor in your family.
no, like my brothers, they are into like entrepreneurs and you know,
Okay.
various other things. But
Right.
I'm the first generation doctor
Okay,
and
right.
a surgeon. So I'm a plastic and cosmetic surgeon.
Okay.
Yes. So
That's why
There
Kenneth
we
is here today. Get the melanin replacement therapy.
Exactly. Bro, that's just racist. How many times do I tell you?
So that again is like that is I'm busting the myth and
Please
if you
do,
say
yeah.
plastic cosmetic surgeon, suddenly people think you're a cosmetologist and this is my expression.
This is what I've been saying
You
to
know,
everybody.
I'm not a skin doctor. You know,
Okay.
the problem is the world, the general
Mhm.
population, the masses believe surgeon and they think a man because it is a male-dominated
Okay.
field,
Okay.
being in
Okay.
surgery.
Yeah,
you know, and surgeon. So when you say I'm a surgeon, so then the next question is, do you really cut? Do you really do surgery? I said yes, I do surgery.
Right.
Like I really
You get
do
the blood on
actual
your hands.
surgeon and
Yeah.
so yeah, there are very
Mhm.
there are it's an I would say 70-30 ratio of
Okay,
male
right.
to female surgeons in general.
Okay.
And then when you're looking at a super specialty, it could be neurosurgery, cardiac surgery, brain, liver surgery.
Right.
These are all super specialties. And again, you
Right.
have male domination, and plastic surgery is another super specialty like a neurosurgery. So again, we have lesser number of women. So it's people just think suddenly, oh, plastic surgery.
Yeah.
Oh, are you a cosmetologist? So do you treat skin? No, that is a dermatologist.
Okay.
And a
That's why we
dermatologist.
take you, Ken.
Also, a dermatologist, like we have, like in my clinic, Dr Karishma Aesthetics, we have our dermatologists who treat aesthetic skin issues.
Okay.
Your medifacials and your lasers and your
What's a
melanin,
medifacial?
whatever.
What's a medifacial? What's a medifacial?
It's like happy go feel like treatment where we use these little vacuum and a feel good, a medicated spa. I would
Okay.
say what
Okay.
you do at a salon would be a facial, but we call it medifacial because we use medicated serums to treat skin.
Okay,
It could
okay.
be brightening, it could be pore clarifying. So that is what our dermatologist does, treating the skin, and they are called cosmetologists because
Okay.
they're treating aesthetic skin. But there are also medical dermatologists who treat more skin conditions, medical skin conditions. But I tell people, I'm a plastic surgeon. So we
Right.
do reconstructive surgery. There are two things to plastic surgery: reconstructive surgery, trauma, burns, and then aesthetic surgery is one aspect of it.
Trauma,
which I
burn,
have
okay.
now, specialized in.
Right.
I think like lately there was there's very tragic news of people getting like acid attacks and stuff.
That was a
Yes, I mean,
Yeah,
it's
I think-
always been around, and during our residency,
Okay.
I did from St. John's Medical College,
Yeah.
one of the oldest plastic surgery, residency
Right.
programs in Bangalore.
Yeah.
And
Shout
so
out St.
we
John's.
had and it's one of the only centers besides Bangalore Medical College which had a full setup burn
Okay.
unit.
Yeah.
So that's the first thing we're exposed to in residency of plastic surgery is more of reconstruction. We treated a lot of burn patients.
Okay.
It's acid attacks. It could be flame injuries, electrical injuries. It could be
All sorts of-
accidental,
yeah.
suicidal. Many.
Suicidal. How does that work?
Suicidal, it could be
People who get hurt
done
by
to you.
attempt suicide, I think.
I mean there are various ways where someone would
Would
not
burn themselves.
want
Okay.
to
So then what made you
burn
switch from
themselves.
that to, like-
Accidental, some suicidal,
Yeah.
some intentional, done to you.
Right.
Right.
Yeah. So I've seen that, and we have treated so many in our burn unit in St. John's, and
Okay.
so we did a lot of reconstruction, more than aesthetic when we are trained. But then I was always interested in aesthetic part of it. So
Fair.
many 5-6 years after my residency, I was doing reconstructive predominantly and trauma surgery, which means facial fractures,
Okay.
and we deal a lot with the orthopedic surgeons because they have somebody has a bone injury, and then
Yeah.
you need a skin cover, wound care, and that's when the plastic surgeon comes for tissue coverage and things. But slowly I moved into cosmetic surgery, went for the
But then
did
what got you interested in like cosmetic surgery?
I
how did
was
it start?
interested so I was always interested in body contouring,
Okay.
rhinoplasty.
Why?
And why? Because I don't know. It just comes into you.
Just
Like you
came.
develop it. Like when I finished med school, I knew I wanted to be a surgeon.
Why med school? I want to ask.
You have to do med school
We're going
to
all
be
the way back.
anything.
I'm going
Very
all the
deep.
way
Going all
back.
the way back.
Yeah,
No.
like,
Yeah,
why
I
med
want to know
school?
like why
Okay,
med school?
so yeah, med
MBBS
school
is not a joke,
happened.
bro.
Many doctors will say it like, I took science because I'm terrible in math.
Can we
One of
test
the
it out?
reasons. Yeah, but in school, I was very much focused not on science. Like I was a swimmer.
Okay.
I used to swim with YMCA,
Oh, damn.
and I swam for the school. And then
Isn't YMCA a young man's
Young
something?
Men's Christian Association.
Yes, I mean everything
Yes.
was so male oriented for generations.
Oh, I'm sorry.
I
I
mean-
just asked a clarifying question. Calm down.
Yeah, but there were a lot of women swimmers also use the YMCA.
Hey, no, YMCA was like a community
YMCA was a
type.
community.
Yeah.
I'm sorry, I got young man, bro.
But it was known,
Yeah,
like that
that's
yeah.
for many years. And
Yeah.
so I used to swim, and that was my main interest. In fact, I got a scholarship from my trainer in Bombay to go to Australia, and I was pretty much focused. And I was learning jazz with Shamak.
Yo, this resume is just like
this is
man,
insane.
okay.
Dude, I've
So
done-
I'm a dancer, and I think did 4-5 years with Shamak before his first break. So but then when I told my mom one day with my trainer that I want to either dance or I want to be a swimmer
Or I
and I
wanna
could go to
do MBBS.
Australia, she threw me out of the house and said, you know what,
Oh, wow.
Oh, this is a
you
sad
can stay
story.
out till you decide it's going to be lawyer, engineer or doctor, you figure.
Are you
Because-
serious? Like she
I mean-
threw you out the
I mean,
house. Like she.
No,
I
that's
think
figuratively,
you know,
yeah.
See,
Yeah.
but she really said get out of the house. I mean, she's like,
Only
because
half
I'm not
joking.
telling your father,
Okay, okay,
considering
okay.
what my father was doing, and it would not be, so that the generation of parents were
Right.
not so, and today's generation, our generation, they allow the kids to do everything.
Experiment,
and
yeah.
it's experiment. So I was like, what's the next best thing I'm good at? And I think it was biology. And I
Okay.
said, yeah,
Okay.
because math is just not happening.
Yeah, same.
And so, yeah, I like
Sometimes it's
biology,
too
and I
hard.
don't regret that I took up science.
Yeah.
I was from Jai Hind in Bombay, Jai Hind College.
Is that a good college?
It's one of the best. And if you say Jai Hind Science, you're like, okay.
Oh, that's like respect.
Yeah, it's respect.
It's like Christ here.
No,
Is it?
yes.
Okay.
Probably better.
It's like
Probably
Jai
better.
Hind. I mean, we're South Bombay people, we brag about,
Yep.
Jai Hind or HR for commerce,
Right.
Sydenham for
Wait,
commerce.
so she's also a sober girl. It's like
Yes,
there's all
yes,
just
yeah.
Dude, you've done too much with your life.
No, not enough. Not enough.
Not
There's
enough.
so much more to do. It's
Yeah,
just
because now
never
she's going
ending.
social media as well, which
Oh, are
makes
you?
me wonder how why have you made this shift of because it's kind of rare now. I see more and more doctors doing it. But
Yeah.
then what made you think of going into the social media thing and getting into all of that?
I was inspired by a very senior
Undercity
colleague, a
podcast.
dermatologist.
Oh.
A senior. I didn't know what podcasts are till 6 months back. So my friends told me.
Nice.
So I was oblivious to that. But yeah, from a senior dermatologist, she practices in Bombay, and we had gone for a conference, and she did a survey on which doctors in the room are active on social media. And actually there were mainly dermatologists in that room, and there was I think 1 or 2 other plastic surgeons.
Yeah, because there's content there.
Yeah,
right?
it was a
Yeah.
conference for a certain laser machine that I wanted to buy for my clinic.
Oh,
So, literally there was just 30 or 40% in that crowd besides her who are active. And I said, all your profiles. And then she gave this talk and inspired, and she said, if you need to do it, first of all, we have, even in India, very few plastic surgeons in social media.
Yeah.
Again, there are no women plastic surgeons, hardly.
Yeah.
Okay, so you must. And then I realized, and I started getting into it, but it was a slow process of learning, trial and error.
Right.
In India, I still, there are a lot of people, a majority, who don't want to see something grueling or blood, and
Yeah.
Right, okay.
Yeah.
and me doing a liposuction, they feel, oh my god, where are you putting that
Yeah.
tube in,
Right,
I
right,
said,
right.
it's just underneath the skin. They're like, no, we feel like you're really poking
Murdering
into
the person.
murdering the person.
Yeah.
Like my best friends are like, they don't follow my stories. Like,
Oh.
it's too difficult to watch for a lot of people.
Mm.
But then
Oh, you
as I
post this
was
stuff
putting
on-
up content,
Okay.
I'm looking at, I started literally actively being about 5-6 years back
Okay.
on Instagram. And I
Right.
built my social media profile, and no plastic surgeons. Very few were already there,
Right.
countable. And in Bangalore, no one, like no
Yeah.
plastic surgeon,
Okay.
was doing it. Female, very less active. If they are, also it was less active. I said, okay, let's do it. And I evolved. I think in 6 years, if I see my earlier posts, I'm just changing, and every 6 months, I'm learning something from someone. My friends who are on social media give me pointers and don't show this, and then I said, okay, people need an awareness.
Yeah.
And I'm going to talk about plastic surgery out loud. It's no more a taboo. People need to know that, and it's okay if you want to do something.
Right.
Would you ever suggest plastic surgery to someone?
I would not suggest anything as a plastic surgeon to anyone. It was more like that person should want it
Okay.
and should have a reasoning behind it. And then I can suggest the options for them.
Right.
Okay. So it
Like
can't be
you
too
have a
superficial
problem.
also.
You have
Yeah.
a problem. Now people say plastic surgery is vanity, but why should it? Now, see, I do a reconstructive surgery. It's an acid attack victim.
Correct.
Okay?
Okay.
Yeah.
And it's that is understandable. You can talk about that.
Yeah.
Why not talk about a boob job? But no, because this is aesthetic. But that acid burn victim that we have treated, I have worked under my superiors, and we have done sometimes. They need surgeries all their life to
Right.
correct.
Okay.
It could be like the face is burned. They don't have nostrils to breathe. We have to create that.
Okay.
We are reconstructing.
Yeah.
But you think a burn acid victim does not want to look aesthetically
yeah.
Look
at
good.
the end of
Yeah,
the
yeah,
day?
for sure.
So
Yeah.
people need to understand in plastic surgery, even a reconstructive
Yeah.
has an aesthetic means
Side
to
to
it.
it, yeah.
I do want to give that person an
Right.
aesthetic outcome, a burn. At the same time, rehabilitate in the form of reconstruction. But reconstruction and aesthetics go hand in hand, is what people need to know. If I'm also doing a breast reduction, a woman suffering from heavy breasts, being socially embarrassed, can't go to the gym, can't wear a good fitting top,
Okay.
can't wear a good size bra,
Yeah.
having back pain, shoulder pains, a lot of functional issues. So isn't breast reduction
Now
yes,
what
an aesthetic
necessity.
surgery.
Yeah.
When I give her a small size, good looking breast fitting well in her top, she's very happy.
Yeah.
But
Okay.
also it has solved so much of her medical issues, right? Just
Yeah.
point
Okay.
taken. So, but I am reconstructing the breast.
Okay.
I am reshaping, I am redefining,
Right.
and that is the meaning of plastic surgery. It's plastikos. It's a
Okay.
Greek word where
Right.
the word plastic surgery came out from, called plastikos.
You tell me
which-
plastic surgery was there since Greek times.
World War One plastic surgery. That is where all our techniques evolved, because all the
World War One.
World War One is
One.
where surgeons
When does it
used to have the army guys to do all these reconstructions.
Right.
So it dates
Yeah.
back from Greek mythology. So the word plastikos came into existence,
Okay.
and in Greek it means to mold,
Okay.
and that is the meaning of.
See, I
plastic
have a
surgery.
question though, right? So I completely understand, like, okay, if somebody has been, like a burn victim or somebody who has faced some sort of like damage, so you reconstruct and then you want to give them an aesthetic look, it's completely fine, right? But then don't you think that plastic surgery also has its limits where people overdo it, right? So my question is, when I see people like in my college, like seriously deliberating plastic surgery, right? Seriously, they look fine.
Tell me also.
See,
Like, I want to.
I'm not arguing with your
Seriously.
Gen Z
No, Jenny,
mindset.
no, Jenny, think about it. Okay, I am.
Right.
I am a 20-year-old like man.
Does he look
right?
like a 20-year-old?
Do I look like a 20-year-old man?
I thought you were about 23, 24.
Okay, I'll take it. I'll take it. I'll take it. It's fine.
How about me? How about me?
You look around 20, 21.
Okay.
I thought you're older than him. He's gonna look like this even at 70, I think.
Yeah.
She knows,
that's,
bro. She
that's
knows.
from his racial genes.
Yeah.
Yeah,
He's
from
looked the
his
same since
genes.
7th grade.
I'm
Nah.
telling you.
Fair.
No, but your genes,
Right.
But how old do you think he looks?
I think 20, 21.
Right.
It ranges from 15 to 70, bro.
No.
Look at it.
So my question is, so
Yeah.
I go to my college, and now see, the thing is, my college has turned into a little bit of a beauty contest. I mean, and
Between
that
only women or men and women? Because
men,
there's-
men,
Oh, man, bro.
men,
I thought
men,
your college is horrible.
or the men just going
No, the men are
six
getting
packs.
there. No, they're getting there. So the thing is, like, see, now it's becoming like more and more normal for a guy to, like, say for example, do their eyebrows or do their nails or whatever, right? So it's kind of becoming like that now. But for me, when I actually like sitting in conversations
Yeah.
where they're actually talking about getting a facelift and she's 20, like everything is up, like your cheekbones look fine, but they're deliberating, getting things done. What do you say to people at that age, like at a
Wait.
young age?
What is face?
No,
What do you
I say
lift
no.
your face?
Yeah,
I say no.
No, it's like, okay,
What
so
is
what
the
So
happens?
you know
facelift?
what's happening is
You put
there is a
Botox
lot
to
of
uplift it.
Oh.
the whole social media influence.
Yeah.
Has taken over the young generation.
Definitely.
And it's recently, sometime back, Zeenat Aman, made a love, she's gone really viral on Instagram. Zeenat Aman has done a comeback.
Okay.
And if you see her posts, and she has lovely things to write, very inspirational from her life. And she writes about social media. That social media is extremely good if utilized in the right manner.
Yeah, definitely.
And benefits you definitely. It has benefited me to spread awareness about my work and what I do. And my patients feel the confidence when they see me, they follow me. that I'm
Credibility.
saying the right things, what is right, busting the myths. But when it influences you to an extent that you talk about a 20-year-old talking about a facelift, then you're going wrong.
Yeah.
You cannot be so impressionable, and this peer pressure is a lot with the new Gen Z thing. And
Yeah.
I would say no, there is a limit, and a facelift is a surgery where we opt for people post 40, 45,
Yeah.
50.
Yeah.
I mean, even I've had a 18-year-old, 19-year-old come to me in the clinic.
A 19-year-old.
Yes, and her dad is sitting outside.
Her
and-
dad's with her. Oh my god.
Oh my.
Because today's generation, parents don't have a say. Unlike us, we were
no, my parents
if
have a
my
say,
mom
bro. My parents have a
if
say.
my mom made these big eyes at me, that's it. She doesn't
Yeah,
say
exactly.
a word.
Yeah,
Like
yeah,
it's done.
exactly,
The
yeah.
answer
That's
is
right.
there.
Imagine
My
going to your
ass.
mom and saying, Mama, I
Ma,
need
ma,
to do a job."
I want bicep increase.
Yes, I have youngsters, and this has been a discussion in our plastic surgery forums, where all across the world, people, the surgeons, we were talking in a conference, and they said, what is the cosmetic age today?
Yeah.
I mean, say my cosmetic age. Say I
Okay.
want to do some treatments on myself. When did my cosmetic age start?
What's
when did
a
What's a
I-
cosmetic
Means
age?
when you
when
start
did I
getting
start
surgery?
doing some treatment?
Okay,
it could
okay,
be
okay.
anything. It could
Okay,
be a
right.
non-surgical, like as I said, the medifacial, something
Okay,
for my
okay, okay.
skin.
Yeah.
It's looking dull, dehydrated, which all of us skin ages, right? And maybe we in our generation, we started at 30, 35, we started feeling, we should do something to our skin or this. We were least bothered at 16, 17, worried about
Yeah.
getting into med school. I was worried about my entrance exams.
Yeah.
I did
I
not
swear.
Fair.
care
Yeah.
about boys or how they perceived
no,
me.
no, no.
I was
Oh, come
a
on, are you
tomboy.
serious?
No, no.
I was.
Doctor.
I can.
don't
I
hit us
can
with
vouch, and every boy was my friend in college can say I was a total
That's the problem. She
tomboy.
had the boyfriends. You get what I'm saying?
I've always had more friends who are boys. My mom
Ah.
always said because
This is our territory,
I grew
doctor.
up with two boys. I grew up with my brothers.
Okay.
I was tomboy. I played every sport in my entire building as we grew up.
What sport?
Obviously, swimming was one.
Yeah.
But we loved playing cricket and we loved little basketball. We learned a little of everything. Even put yourself in a little bit of. My brothers were excellent in football and stuff. So we would
Okay.
Yeah.
play everything
Your brothers
possible.
are damn tall, no?
My brothers?
Yeah.
One is tall, one is just about my height.
Okay.
That's tall.
My dad
That's
is
the
tall.
thing.
My dad is very tall.
Okay, let me tell you why it's like we reacted the way we did. It's because with our generation today, if a girl has like too many male besties,
We know what's
it's
up.
it's like a little bit of a red flag.
It's a
for
red
us.
flag.
Back
It's a
then
red
it
flag.
was
No, back then,
Yeah, that's what I'm
millennials.
saying.
No, I think, especially me, I was a complete.
Aren't you Gen X?
Huh? No, I'm a millennial.
Oh,
I'm
okay.
purely a millennial.
Okay, okay.
I'm not that young.
All right.
I have got
Okay.
the grey hair.
Right,
I'm the
right.
grey
Okay,
haired
okay.
All right,
surgeon.
right.
But no, the kids need to know that no, surgery is not for you. If you walk into ethically, medically, I don't think it's sound to do surgeries before 21. See,
21?
Our structure
Hmm.
is completely developed, whether it's bones in our body, cartilage, tendons, tissues.
Right.
We are completely developed by 21.
Okay.
Okay.
For girls, we say 18. For boys, we say 21.
One more year.
It's okay. Legally, yes. Legally, I would say between the ages to 18 till forever, you can do plastic surgery.
Yeah.
But you must really have your reasoning and be very sure because it could be rash decisions. This is not just going across to a tattoo studio and getting a tattoo and then
Yeah.
regretting it later and you cannot turn
Yeah,
back.
yeah.
Okay, once it's done, it's done. Even Botox fillers, I would see my generation people starting at the late 20s or even late 30s or 40. I've seen, to see, okay, I'm getting those wrinkles now and I need it now. And it's justified, I think.
Right.
So that's cosmetic age. When do you start doing some treatment? at that young age, I think at 18, 19, you should think of your skin first. You have acne, you treat it. You have scars, you treat it.
Why, bro?
No, the thing is,
Yeah,
why
give me an appointment tomorrow with my dog.
he just pointed at you.
Why he just-
You
Really?
wanted-
Yes.
What a horrible guy, bro.
As, you know, bro,
Medifacial.
No, no.
Nehal has just told me that I need
Medifacial.
skincare, which
Skincare.
see I
How dare, bro?
no
No,
I get it.
I
get
don't
it.
think he uses a face wash also.
No,
I mean, that's very typical of
Men.
no.
it is.
No,
One thing,
men,
one-
boys,
okay.
not face. They're like, I'm using but
Garnier is fine, right?
Yeah. I mean, it's okay.
Garnier what?
Face wash.
Oh,
you
you
have
do
the,
use
the
face
charcoal
wash.
Oh,
one.
that is cap. That's cap.
You know what, bro?
He wants the John Abraham.
So, that doesn't not use anything. That's
I do. I use, man. I use Synthol and
No,
all.
but yeah, I mean,
Bro.
most as compared to the girls, when boys come in, it's
Yeah.
usually like their skincare routine is pretty bad.
Water.
But yeah, water. Many say like water. No, I can understand
Water. I mean,
See, I'm like a Pears baby. Like till I was 35, I think. Like till 5 years back, I still use Pears on being in this profession. Till I opened my clinic, and I
Right.
had my colleagues who are dermatologists, and then I was in, exposed. I was totally into surgery, and then I have colleagues now who do skin and skincare. And when I had to set up my clinic, I got to know so much about aesthetic skin, stuff.
Yeah.
And then my dermatologist was like, seriously, you're using Pears? I said, yeah, but I have like good skin, and like my mom has used Pears
Precisely.
forever.
Like, Pears is like so OG though,
But then
right?
Pears.
it's an OG, the original.
Yeah,
that's
some
now
people
what-
say Pears. Please stop saying that.
Yeah, Pears, yeah.
Pears soap.
Yes. Blue color Pears, please.
I think the blue was my favorite though, bro. Pears
Yeah,
soap.
so
Yeah,
but then I
but then
realized
stop.
that,
Stop.
and then I started using like, some better face
all the-
washes.
But then-
Dettol.
Okay,
And I realized that it has gone better, the skin, and I realized
What
that
soap do you use? Oh, we
No,
need
I
to
don't- I
explain
don't
us
know
on
soap
this.
anymore.
Yeah. You know what? I have a question
I
to
have
ask
a
you.
nice skincare routine given by my doctor.
That
Please tell us.
Doctor has a doctor.
Do you have
Yeah, I have my dermatologist who's like
Yeah.
my skin doctor.
You put like salicylic acid and all that.
Why would I need salicylic? You need salicylic. You've got the acne.
Wow.
Nothing wrong in that. See,
John,
you don't have
my
to.
boy.
You have to accept that I
Hey,
have.
but someone's calling me. But just go quickly.
See, there's nothing wrong if you have it, you treat it and get rid of it now.
I've been
But he hasn't. That's the problem.
And then you know what happens? You
And
come
I've
10
been
years
using it for
later
few
when you have
days.
scars, and then it's
Oh,
very
it's getting
difficult to
cooked.
get rid of them.
I'm getting fried. No,
See, you'll realize it when you then decide to get married, and that time you'll come to me and like now take care of these things.
listen, if you're
Which is
watching,
very
I'm
late.
not putting salicylic acid. No matter how much.
Wifey.
No.
This is not happening.
Okay, I have a question. Okay, this has been
But
bugging me out for a
please
while.
tell everyone, do not just put anything off the counter, what
Men-
you see. Visit your
Local
dermatologist or
dermatologist.
cosmetologist,
Yeah.
and then take prescribed skincare products.
I'll be using Himalaya and everything.
Nowadays, I'm sorry, but like no, intent behind this,
Okay.
but like influencers these days
They get paid to do
promote products like they
Yeah.
know skin and they know the basics, but
Yeah.
Vanya,
one
please.
should meet your skincare specialist, which is a trained doctor in dermatology or cosmetology, and then take stuff. Not we have a lot of people coming in, and my dermatologist, when she's questioning what do you use, no, but this influencer said this skincare product, so I've been using it and it's totally wrong.
Right.
Sometimes okay, you may get right, but I feel the right person to talk about skincare is a skincare specialist. Like even
Yeah.
I should not be talking. I'll do my surgery and I talk about.
Yeah, so
plastic
maybe I don't
surgery.
need salicylic acid.
I cannot say. You'll have to
Maybe.
meet. You'll have to meet the dermatologist.
I'll meet a dermatologist.
Yeah.
But I have a question to ask you. Okay, so right now, I personally think it's a marketing gimmick. But then let me just put this out there. Okay, you know how like I know many friends of mine who have like 4 tubes of cream. Okay.
What?
Oh.
And one tube is
Don't
face.
say Fair and Lovely.
No, one.
That is
Glow
a
and
$1 trillion
Lovely.
business.
I know, right?
See,
Man.
there's one that is hand cream.
Okay.
One that is face cream. One that is body cream. Are they all just the same thing? Or is it just like a marketing gimmick that they're selling to like sell more tubes of cream?
No, put.
Sometimes I
Business is
wondered
going
also.
down.
Sometimes I also wondered, like, you buy these creams and, you read all
It's the
this
same
stuff.
thing, right?
This sulfate and this
Yeah.
methacon, and you don't even know these words.
Unicorn.
And why we actually using it or
Yeah.
whatever. But
Yeah.
yeah, there are some creams which do make a difference.
Yeah, but I'm
So-
talking about like hand cream and face
Bro, I
cream.
didn't know hand creams existed for the
But they
longest
did.
time. Like
They do. And like, actually they do work. For some people who have really dry hands, and talking about me.
Okay,
like,
okay.
For me, even I didn't know this. Recently, I think since a year in my clinic, dermatologist ordered some hand cream and all, and I immediately realized I need it because as a surgeon, at least 10 times a day I'm washing my hands.
Even
Okay.
And you know,
Wait, you can tell I
it's
moisturized.
terribly dry.
Sorry.
And so now I realized on my consultation table, I keep that cream, and I realize every time I wash my hand, like now I like to keep it, and I feel hands are better.
Okay, but
Okay,
it's not like
so
if I
you
take
do it
face
every time
cream.
after you wash?
No, it's not
Because
like
I wouldn't do it normally, but now that it's
Uh-huh.
on my table, I'm just doing it, and it
Yes.
helps. I realize.
Okay.
So,
But then doctor, it's not like if I take face cream and put it on my hand, it's not gonna make my hands less dry,
nah,
right?
doesn't matter.
Doesn't
You can
matter,
put face
right?
cream on your hand. Yeah.
Myth
Yes,
busted.
Yeah.
Just buy Nivea.
There
Just
are-
by
Body
just by
milk.
Nivea,
Yeah,
16
like,
in one.
You know, like there are some neutral creams like Cetaphil, and their face creams is good for the face, but
Yeah.
it's okay if you use them on the hand.
Yeah, true.
I think there's some friends I have that's like my granddad made this cream. I'm like, what?
What? No, no.
yeah,
No, it's
yeah. Like there's like my grandma made this cream. I just use it for everything.
No, what about putting
There
hand
are
cream on your
homemade
face?
Yeah.
remedies which work well.
No, I go to college and like someone will ask for like moisturizer because me, I ask for moisturizer. Okay, now calm down.
You want to like
See,
woo a girl?
No.
Take a pot of honey.
Listen.
Take a pot of honey, the best
Busted.
moisturizer.
What honey?
What?
Honey is a
Tell
good
me more, tell me
moisturizer.
more.
Like sticky,
It's
like Dabur honey.
like once upon a time we put honey on wounds, like turmeric
Okay.
and honey. So it's an antioxidant,
Okay.
and it is.
So I take Dabur honey and put it on my face.
It's not like just put it on.
Face mask.
No, but yeah, honey into a little bit of besan and little curd is
Uh-huh.
a good face pack for just home. And
So
just
if I
to
want to
feel
get a
good.
girl, I just put honey on my face.
No, not.
No.
No,
Jay.
just honey.
Not just honey.
Okay. No, but see, the thing is, so
Okay.
people in college, right, they say, I say, my face is kind of dry right now. Can I have like moisturizer?
Yeah.
Right. And then she's like, no, all I have is hand cream. I'm like, no, so just
It's just
give me the hand cream, right? And they're very like, oh no, the hand cream is for the hand, my
It's
leg cream is
interesting
for
to
the
see,
leg.
like at a much younger age, everyone's getting more conscious about
It's
themselves.
because people want to
and-
look older. That's the thing.
Yeah, I don't know why that. I mean,
But it's because we live in a generation of cameras now, right?
Yeah.
yeah.
No, it's like no. See,
That is why plastic surgery soared after COVID 2.0, 1.02.
Yeah.
My practice went because suddenly you're at home and you realize you're looking at yourself. There are more webinars, Zoom meetings, and
Yeah,
for
yeah.
a point at COVID, plastic surgeons across the world, we thought that we are, no one's going to think of. Reshaping or cosmetic
Yeah,
surgery
yeah.
when COVID is happening. In fact, we are an elective. There's nothing emergency in cosmetic surgery.
Yeah,
so
yeah.
I need a
government-
facelift.
the government, asked many of our kind of like plastic surgeons, etc., who do cosmetic or any profession which is an elective surgery,
Yeah.
to hold pause.
Yeah,
for
sure.
like
Yeah,
a
yeah,
month or
yeah.
two,
Makes
because
sense.
obviously, the city needed oxygen cylinders
Yeah.
and
Yeah,
so
more
wherever
rooms
we
and
could
whatever,
save
yeah.
up. So
Yeah.
we didn't operate for a month or two after 1.0, 2.0.
Right.
But it was interesting because people sitting at home started seeing themselves, oh my face, oh I'm feeling older. Some
Yeah,
people were
yeah.
depressed from COVID. Some people gained weight. So,
Stop it, Nehal. Stop it.
Nehal is giving you the stares.
Nehal is looking at me like, bro. I had
Okay,
Okay, you need to
Horrible
stop
guy,
it because
bro.
you're
Horrible.
blushing. You're like red.
it's about John.
No, but I had a very good glow up over the lockdown. I
There
grew
were
a
so
beard.
many issues.
Bro, I'd lock his ass out, bro, after shoot. Take him outside and beat his ass out.
I mean, so many things, COVID-related hair fall, COVID-related skin issue, COVID mask-related acne. So like,
What?
Yeah. So people constantly
COVID
wearing
mask
masks.
acne.
People were developing acne. So our dermatologist doctors also like busy treating COVID-related hair fall, acne, skin going dull.
Okay.
At home, in terms of plastic surgery, I in fact operated on a lot of my doctor fraternity. A lot of people who suddenly were going on shifts or people who were working from home. Now they also had time to recover. So it was surprising and but it was interesting to see how we think.
Yeah, but like I feel like I told you, right? Like this generation is mostly like very camera oriented.
Yeah.
Yes.
How do you feel about like social media?
The competitiveness
Yeah, like,
about it. Like, I feel like it's way more, like the onus falls mainly more on the women than it does on
We
guys.
can, this debate can be, never ending, but there will always be two sides to a coin. I would say don't overdo it, but
It's
you
PR
cannot
train.
stop if
It's
you.
PR train.
Yeah, it's a PR thing, or
Yeah.
what do you do? I mean,
Which side are you on?
I mean, like, whatever you
Obviously,
do
she's for
in life, whatever you no, absolutely not. If
Oh,
someone
see.
see, there are certain plastic surgeries
Yeah.
which are warranted.
Yeah.
Okay.
Even for a 16 or 17-year-old, even boys and girls.
Which are?
Like a condition called gynecomastia, or male developing unusual growth of like the breast gland in their chest. And I've had young boys who do come with psychological issues. Like I've had a boy at 16 who refused to go play sports, etc. He's like, I wear a tight band and everyone teases me and I can't go on. And no, it's not funny. No, actually it's not. No, I don't think we should laugh on that.
I'm so sorry. I'm so sorry.
But
I'm so sorry.
It is not easy for that boy.
Yeah.
And I think sometimes you have to see a counselor, and if they come and genuinely the counselor believes that I think this boy needs to treat this.
The school will be on board with it?
Actually, it's not a school thing.
Okay.
It's a personal, and because they are underage, obviously they have to have the parents thing. But we always put them through some counseling sessions.
Okay.
And sometimes it's very bad cases
Okay.
where.
How does that happen, by the way?
It's just
Genetic thing?
no, it's not genetic. The commonest cause of gynecomastia is like idiopathic, which actually means there is no cause, but when we are going through the puberty, so there is a surge of hormones in men and women.
Yeah.
In women, of course, we develop breasts, but in men, obviously the testosterone takes in, the estrogen drops,
Yeah.
and sometimes when there is an imbalance in those hormones, may not be seen on a blood test, but sometimes unwantingly, if the estrogen has been surging, the boy develops an abnormal growth of
The chest, okay.
tissue on the chest.
Yeah.
So, it can be so bad that you don't want an 18-year-old having a chest which looks feminine.
Yeah.
Or
It can be very
And even though he's not like fat, like he's not.
No, sometimes they're not fat.
Just
So
mentally
when they
takes a
come to
toll.
us, sometimes if they're a
Okay.
little on the fatty or healthy side, we say, try to lose your baby fat away, work out, exercise. Many of them do that. And after losing weight, still there is that problem.
Yeah.
And you can see like it looked puffy and funny in a t-shirt, and it is embarrassing. And that is there are those cases where I would say yes, he deserves to be confident and not spoil his best young college days and being teased at and not being able to play sports, wearing a chest band under his
I'm sorry. I wanted to know, like, the male players have that chest thing. What is that? What's that for?
So track them, no? Track stats.
no, that's different.
That's different, no?
This is like, the guy is
Okay,
feeling
like-
embarrassed with his chest popping out through his t-shirt, so he wears
like a compression.
band compression to just keep
compression
it in.
band. Yeah.
What's a compression band?
It's
Like
compresses your
it
chest.
could be any like a velcro strap or some
Same
compression
whatever you're
band.
talking about is
Yeah, it's like that, but then
Oh.
it just makes it look smaller.
Is that what they refer to as like a man bra?
Oh, not
No.
really.
No.
What is a
What's a
man
man
bra?
bra?
Yeah, I don't know. I've
I
heard
just
people
said-
saying.
No,
It's a man bra.
I've heard people saying man bra. I don't know what.
Let me look this up.
Yeah, we need
That's
a
new to me
myth
too.
bust.
Yeah. But no, see, the thing is, okay, I wanted to ask, right? So right now, it's more and more men are getting into like
Yes.
cosmetic surgery, right? So do you what's the most common thing that men look for when they come for like some sort of like touch up or anything? So what's the most common male cosmetic surgery that you've seen so far?
I think gynecomastia,
Which is
The
which
same
is
thing.
this abnormal.
right.
Then we do see a lot of liposuctions,
Men.
which is body contouring.
yeah.
I mean, there are boys who are struggling with weight loss, not weight loss, I would say, but
Loose
stubborn
skin?
fat.
Loose skin. I want to
Loose
know how
skin.
loose skin goes.
Yeah.
Um,
Like how does that happen?
loose skin
No,
can
that
happen
happens.
due to various reasons.
Is
I
it
mean,
like rapid weight loss or is there like
rapid
a
weight
genetic
loss,
component
massive
to it?
weight loss.
Okay.
Because it's like something getting just suddenly deflating.
Yeah.
So a massive sudden weight loss.
Okay.
There are a lot of people undergoing bariatric surgery, which is a weight loss surgery. Like liposuction, that's another myth. People believe liposuction, I will take out fat from the body and I lose weight on the scale. It is not a weight loss surgery.
Oh.
Making it very clear, bariatric surgery is a weight loss surgery where you have to do band up the stomach or
Wait,
you
so
know.
in a liposuction,
You remove fat.
but that doesn't make
cells.
you lose weight?
No, it is a technique of body contouring. So when you remove fat from a particular area, you look slim in the area.
Okay.
But unless you don't diet and exercise, you will not see. You look thin there, but you will not. So
On
the
the
body is not
scales.
figured
Right.
that the fat is hollow when you cells are hollow when you even take out in a liquid form from the body.
Right.
So you will look slim and you can contour the area of the body.
Right.
But you will not lose weight. So it's not a weight loss procedure. It's a body contouring technique.
Okay.
Whereas bariatric surgery, where bariatric
Okay.
surgeons do, where they staple the stomach, and these are for the really overweight people who need to lose massively.
Yeah.
That is a weight loss surgery.
Right.
Bariatric surgery.
I think with gaining weight, you get these like the skin. What?
Stretch marks.
Yeah, stretch marks.
That you have to visit the dermatologist. Not
Right. Right. Ken, it's fine. We'll go.
No, I don't have. Like, I mean, no, I do. But like, isn't that natural? Like when you gain.
No, I feel like the stretch
Even
marks.
when you gain and lose.
Yeah.
Skin,
Lose weight.
it's like a pregnant uterus. No, the women get stretch marks because the skin has expanded.
Yeah.
The skin is is the most elastic organ and the elastic organ of the body.
Yeah.
It can
I forgot it's an
expand
organ,
as
to be
much,
honest, yeah.
but then suddenly it goes back.
Yeah.
So the skin has been subjected to that degree of
Yeah.
stretch. So there is a permanent break in the layer of the skin we call a dermis,
Yeah.
which creates the stretch mark.
Right.
And usually stretch marks are permanent unless they are in the initial stages where the stretch marks look like reddish.
Uh-huh.
And you
Okay.
can treat at that time and get rid of it. But once they are old, long-standing, white, thick,
Yeah.
then there are lasers which can lighten them a little, make them look a little better.
Right.
But no one has figured in the world yet 100% treatment for stretch marks.
I mean, we all have stretch marks right from working out.
Bro, my
but
shoulders
what
are
about-
crazy right now.
yeah, I mean, a lot of
Yeah.
people
Yeah.
have it.
I mean, you also have, right?
No, but those
I
stretch
don't
marks.
have.
Those
His
stretch
You don't
skin-
have stretch
his
marks.
skin-
Sorry, he
skin-
doesn't work out. My bad.
No, but his skin, his skin likely not to have so much of stretch
I don't
marks.
have.
Yeah.
But,
not as visible is what you're saying.
Indian dark toned skin, brown
Doctor, I
skin.
almost said it.
I said Indian brown
Dark.
skin,
Can
like
it-
ours, my skin, wheat skin. So, a skin type.
Doctor.
We have, I have, okay, let me say, we can have more chances of getting
Yeah,
stretch
you can
marks.
see it more
And see
easily.
more, obviously.
Yeah.
But,
It's not visible.
Yeah, it's not
not
as
visible much in your skin.
Yeah.
But yeah, it's prominent in our brown skin tone.
Fair.
Yeah. No,
Okay.
but I feel like certain stretch marks are like respected.
Yeah, it's like a sign
It's like
of.
a sign of like it's a stripes of honor. Like
Yeah,
they
yeah.
call it. Okay, so the thing is, Shimon has sent me a message. Okay, I got to answer because he asked me this question. is
Yes.
okay. Okay.
She's trying to say
Today is
that.
definitely my first experience with a whole bunch of Gen Zs in one. This
Sorry.
is the first.
This is the question. Okay.
How are you liking it so far, by the way?
Quite fun. Quite
Okay,
fun.
fair,
I
fair,
must
fair.
say.
Is a Brazilian butt lift healthy in the long run?
Shimon, what?
Healthy.
Good question,
I don't
good
know about
What is a Brazilian butt lift again?
a
You
Brazilian
know-
butt lift was a technique invented by a Brazilian surgeon.
Okay.
Um,
Is it just silicone in your ass?
no. So
I'm so
that
sorry,
is
bro.
buttock augmentation where we put
Okay.
implants to enhance
Okay.
the volume of the buttock.
Okay.
But when we take fat from an area of your own body
Mm.
and inject it into the butt, it's called the Brazilian butt lift.
Oh.
A butt transplant.
In fact,
No, it's a fat
Brazilian
fat
butt lift
transplant.
will be a fad now.
Okay.
But a book written in 1989 by a very famous plastic surgeon, Dr. Louis Toledo, is
Oh, yeah?
one of those surgeons. I know him
Personally?
I personally know
Wow,
him.
okay.
He's part of our international society. I've met him, and he's visited. He's visited Bangalore. 2016, I had organized one of these, plastic surgery conferences.
Okay.
In,
Yeah.
And he loves Indians. He loves India, and very very senior surgeon.
Mhm.
I'm talking 1989. He wrote about the Brazilian butt lift and
Oh.
the technique.
Damn.
It has advanced. So it's just that it's become a fad because one of the celebs did it, and it
God,
became
who's the celeb, by the way?
huge.
I want to.
Yeah.
Doja Cat.
We can look at celebs and wonder what they have done. Possibly they could have done the Brazilian butt lift. They could have
Yeah.
put silicone implants. I mean, the usual names were always Kim Kardashian, Nicki Minaj.
Yeah.
Okay.
They're
And
all-
there was a certain body type they liked. I would say it's not about healthy or not. See, we look at someone and says, oh, that's a botched lip job. We look at a celebs. I think high time we leave celebs alone.
Mm.
Okay, they are also people
Mm.
who
Yeah,
want to do
yeah,
something, perceive
Yeah.
themselves in a certain way,
Yeah.
and let them do it. You may not like it. I may like it. He may like it.
Yeah.
So
I love
it is.
it.
So
Ken loves
again,
it.
it's not about healthy or not, but
Yeah.
if someone wants to look in a certain way, they are allowed to look.
Yeah.
When you do multiple cosmetic treatments, when people get obsessed about plastic surgery,
Yeah.
and there's no end to it, and they get obsessive about it, then it's not a good thing.
Yeah.
So we do encounter a very known condition called body dysmorphic disorder,
Yeah.
Okay.
which is BDD,
Yeah.
and that is not healthy. And as a plastic surgeon, we like to identify if someone across
someone actually
my
has it.
consultation table
Yeah.
is probably having a BDD, who's constantly asking for unrealistic things, with
Corrections.
unrealistic expectations
I
and
wanna look
corrections,
like
and
Salman
doing
Khan.
it non-stop.
Yeah.
Where a point I feel they do not require it, and that is when I think personally, my ethic is to just say, you know what, no. You must see a counselor. Is this really making you happy? Because whatever I
Yeah,
do may
because you're
not.
chasing something. and
You're
that's
just
it.
chasing something, and I may not be able to give you. So this is what is unrealistic.
Because it's a lot of weight on you
expectations.
also.
100%.
Right?
It's
Yeah.
unrealistic expectations at
Yeah.
times. So
Yeah.
I think all plastic surgeons, we keep trying to tell a person, no, when is a good time, or are you fit, when do you think you should do plastic surgery, or are you a good candidate to do any cosmetic procedures? Is
Right.
if you are absolutely sure in your mind that this is the procedure which I perceive myself to do, it could be whatever,
Right.
and you're mentally motivated and positive.
Right.
You are obviously physically and medically fit also.
Yeah.
With a person having realistic expectations. So that is a good person to, undergo any cosmetic surgery.
So what kind of health
So-
conditions stop people from getting cosmetic surgery?
No, we do procedures even on diabetics, for someone who
Is
has
that safe?
hypertension. We have to make it safe.
Okay.
So if someone has diabetes or thyroid issues, we
Yeah.
have to make sure their medical blood evaluations have to be done, their medical checkup has to be done. If their values are not normal, I cannot operate on a person.
Okay.
I have to make
Not
sure
safe.
they have to go back to the physician, correct their sugar levels,
Right.
have a few weeks of normal sugar, and I know that. So we have to get them medically fit to undergo a procedure. Obviously, with internal medical issues, you do fall under a certain surgical anesthetic risk,
Right.
which is explained to them.
Right.
But it's not that we do not operate on someone who has medical issues. But unless it's a very severe case of some heart issue and which is really not worth it, I
Right.
think as doctors we always
relax.
recommend that
Yeah, just chill.
you
Just
must
live.
take your risk, or
Yeah.
Yeah.
beyond that, if they still are ready and willing to take the risk and do a procedure, it is their will.
They sign the waiver.
Yeah, see, a
Yeah.
consent form is universal.
Yeah.
There
You
are
have to,
consent forms worldwide, and we have certain standard protocols for what a patient needs to sign on before any different procedure. So we have, they have to sign, and they know the pros and cons. What are the unforeseen
Yeah.
circumstances? There are a lot of unforeseen side effects.
Right.
We have to tell them all and be very clear.
Right.
Sometimes patients don't want to hear it, but it's the way that we
Yeah.
tell them and make them feel safe that they, with all of that, as doctors, we are still there. A side effect can always happen
Yeah.
with any procedure. Why not? Why just plastic surgery?
Yeah.
I think
Yeah.
the most relatable thing for our generation right now is, so people have we have this culture of self-improvement now, and a lot of people are starting gym and everything. But the most common case I've seen among my peers also, among my friends, it's they'll work out for 7-8 months and they look huge, they look
look
good,
good,
they
yeah.
look good, but then it's the body dysmorphia hits and they're where am I missing out?
Where-
And when
where is my
I
DDT,
yeah.
yeah.
No,
Yeah.
do you know how body dysmorphia works?
No, it's not. There
mentally.
are some people working out in
Yeah.
the lifestyle, and I always tell my patients, and they all know, any one of my patients watching will agree. I'm very clear about a lifestyle, exercising,
Okay.
even with liposuction or whatever. I make you a 6-pack, or I give you a perfect waistline, or I do a Brazilian butt lift. But without a healthy lifestyle,
He's not gonna
supplementing
maintain
it,
Yeah.
one, you will not be able to maintain it. Gaining massive amounts of weight post cosmetic surgery will change the results of the
Yeah.
procedure.
Yeah.
And the body dysmorphic is when they are constantly believe that something is wrong with them.
Right.
It's not about a guy going to a gym, he's struggling in the gym, really working out, but he's like, no, damn, those love handles are just not going.
I swear.
mean, that is okay. I mean, I personally, go to the gym and I have these few areas of fat, which I will not mention, but
Okay.
they trouble me, and I've been working out since years.
They never go.
And there is that stubborn thing. But if I'm a person, I'm a plastic surgeon, and I believe that at one point I've told my trainer, you can try your best. I will give it my 100% best. Beyond which, if it's still not, there are certain stubborn pockets of fat which are genetic, exercise resistant, and sometimes diet resistant, no matter what.
Thank you.
And it is justified. Like, I can decide at some point,
Yeah.
while I'm healthy, I said, you know what? It's one life. Like, why not I just take it off and wear that bikini and flaunt it?
I swear.
man,
you know what,
this is why my bikini and flaunted.
Dr. K.
Why is a doctor not allowed to get into a big...
No, I said I want to wear the bikini.
Huh.
Yeah.
You know
So,
what?
it's justified, right? Like, the guy is like, Doc, I'm struggling in the gym.
Yeah.
This little thing just doesn't go, you know?
Yeah.
So get rid of it. It's a 45-minute thing, a small love
That's
handle.
it?
And for just a
45
small love handle for somebody who's already thin,
Doctor, we have to
doesn't have
talk.
much fat.
You understand
good
45
BMI.
minutes?
45 minutes, love handle's out.
John will take it.
Okay,
Undercity is paying me dividends
40
this month end.
45 minutes or 3 years.
Yeah, no, that's not.
Come
No, guys,
on.
this
Don't
is
make it
not
Don't make it
medical
look like a
advice.
shortcut.
Take a
Don't make it
shortcut.
look like a
Yeah,
shortcut.
guys, this is not.
This is
listen,
no shortcuts,
Yeah.
and
This is better than a shortcut.
This is the solution.
It's liposuction.
Dr.
No.
Karishma aesthetics.
I say no to a lot of patients who come who
Right.
are not of good BMI, are
Yeah.
overweight, and using this as a shortcut.
Yeah.
I'm very clear to them. Like,
Right.
listen, please give it everything that you have, and
Okay.
Yes,
try
Shimon.
your best. Lose as much as you can. Then come to me what you're not able to do with all the effort and you've exhausted all your attempts. Yes, a few people still believe. There is a percentage of men or women who think, Doc, I've tried everything, and they believe they're exhausted and depressed now.
Okay.
And like, I'm done. I'm depressed. I can't think of a diet. I've tried keto. I've tried this. I've done that. I go to the
Right.
gym. I do 3 hours a day. They have thyroid issues, PCOD, and it's not happening. So for them, sometimes when we do whether it's a liposuction or whatever procedure, I see that confidence go from 0 to boom.
0 to boom is
0 to
where I need
100.
go, dude.
Like, they come back
0 to
and then
100.
suddenly what happens, they've seen themselves suddenly looking like this, and they have never seen themselves.
Yeah.
Okay.
And then they are the ones who go backwards, and then they start like, now I want to go to the gym.
Yeah.
Now I'm
Is
hitting it.
it like a false confidence type case?
No, I
No,
would
it's
say-
real. It's real
It's a
confidence.
little
It's
boost.
like actually
A little
there.
boost. A little boost
Okay.
of something. Someone is just given up.
Self-confidence.
I
Yeah.
think it's
Just
probably how we feel
self-confidence.
after a haircut.
Oh, you feel great, right?
Yeah, I
like a
feel-
good hair
yeah.
day. So it's
Yeah.
so
Good
yes,
hair
it's
day.
surgery, and
Good hair
you
day.
can't compare it to the hair day, but
Yeah.
Yeah.
it really brings out a boost in someone's self-confidence. I've seen someone like just there are women who says, because I'm like that, I can't even run on a treadmill. So
Yeah.
how will I lose weight? Where will I exercise?
I get that,
I
yeah.
can't even
Yeah.
touch my toes, or I have bulky thighs. It's a medical. There are certain things which are medically a problem for people to do their daily activities. And yes, an aesthetic surgery, just do a little, give them that little.
Yeah, no,
boost.
I really
I know
want,
people
like,
do.
while we have Dr. K here, I want to talk about something that's a little pressing, okay?
And I feel very nice, after my procedure, like recently a patient,
Yeah.
obviously I can't mention anyone's names because
Yeah,
it's
doc, keep it
the
on
patient
the
doctor
labs.
Yeah.
confidentiality.
Yeah.
But
Yes,
like,
that's
she
not me.
sends me on Instagram her, picture of she wearing this crop top
Yeah.
and working out really
Right.
well. She was working out already, but she was just not getting that thing.
Not in a crop
And
top.
then she's like, I can never wear this. Like,
Yeah.
I go on stage, I can't. And she sent me the video, and I was like,
Yeah.
You look great, man.
wow.
Pat on the shoulder, yeah.
Like,
And all I
that
said
is
is
my
now-
breast augmentation.
I said now just all you have to do is just maintain and don't stop that
Yeah.
lifestyle.
Yeah,
Be
yeah.
consistent. That's
Yeah.
it. That's it.
Okay, I want to ask you about what do you think about body positivity? Like,
Ooh.
yeah, I really wanted to ask you
I mean that is body what she said.
Okay,
to
but
me
here's the
is
thing.
Body positivity.
With Gen Z, body positivity means
Be
something
unhealthy as
very,
hell.
very different.
Yeah.
Yeah, it's like,
Yeah.
yeah, it's like you can do whatever you want.
Speak carefully.
Yeah, exactly. I'm like trying to.
Yeah,
I'm trying to
70%
very,
women
very-
watching, yes.
Very, very carefully right now.
Hey.
So what happens is on social media or whatever, there are these girls or like guys also. Wow. I got it. Carefully.
You know, I'll take it from here. I'll actually frame it properly. So
Okay.
the thing is, what body positivity initially came out to be was, you shouldn't feel bad about yourself. As in, you shouldn't
Yeah.
hurt yourself.
Agreed.
Like, because of your weight or how you look, you shouldn't
Agreed.
damage yourself by having eating disorders or whatever, right?
Agreed.
But then what it's turned into now is an excuse for people to just be unhealthy and have everyone accept it.
It's like as long as you're comfortable, it's fine.
Yeah. And I feel like that sets a very unhealthy precedent. So I want to know your
That's
thoughts
true.
on that.
I mean, See, it's not because I'm a plastic surgeon. I will tell you, I was a very fat kid always.
Okay.
And
Come on.
I had chubby cheeks, a double chin, and but as I said, in my generation at 17, 18, I was least bothered. I entered med school, and that is when I realized, it was no matter what. I was not a plastic surgeon then. I was just med school. I'm learning about medicine. We're learning about our physiology, and I have diabetes and hypertension in my family.
Right.
And that was a beginning starter. And my brother became a personal trainer, and he says, you know what? Now is the time. You get into a routine, because later, like everyone in my family is like huge.
Okay.
And in like my mom and like everyone, they don't need to live, but the agenda was live to eat. And they love
Okay.
food, they love, but they're happy the way they are.
Yeah.
But it's not that. Like I've had people in my family who in the 80s, like my mom's like people, and my mom was all set. Like when she becomes a plastic surgeon, please do a neck lift for me, remove this fat in my arms, because she wears sari.
Okay.
And for her, sari and a blouse.
Yeah,
And
yeah.
even though she was 60, she was very entwined to why not. All my life I've worn saris and struggled with. I don't care if I'm fat here, but like, can you you become a plastic surgeon,
Okay.
take off
Yeah,
fat
yeah,
from
yeah,
the
yeah,
arms.
yeah.
So
Okay.
body positivity. When people say if they like the way they are, fine. If they genuinely have an eating disorder, please see a psychiatrist.
Yeah. Shouldn't be
Exactly.
Yeah.
They shouldn't be
Shouldn't be,
unhealthy.
yeah.
And don't put this excuse, you know what, I like, okay, you like yourself to be fat, absolutely good.
Yeah.
You look in self in the mirror, and if this is what you like and this is what you feel, no harm done, be that way.
Yeah.
For the people who believe that this is unhealthy and I'm not happy with myself this
Yeah.
way,
Yeah.
then you have to change.
Yeah,
And you be
that's-
positive with whatever you are, but don't make it an excuse.
Yeah, here's the
I
thing,
think
no,
you shouldn't
it-
push
it-
it onto other people as well.
Yeah, no,
And then
that's the
don't
thing.
say like, oh, if someone called me fat, I wouldn't feel body shamed. I said, I am fat. I'm like,
Yeah, okay, fair. Yes.
I am-
fair.
Bro, this is
I'm
what happens when
okay.
you have someone
Yeah.
At
grown
one
up.
point, I've been not called fat. They say, oh, she's plump.
She's
Mm.
healthy.
Healthy.
Yeah,
Oh,
yeah,
okay.
yeah.
Prime.
I said, okay, my height, I get away with it a little bit. But now, over the years, like, and more because being a plastic surgeon, I started like want myself to look better and better. And
yeah.
I've started, working out much more than I did 10 years back. And if I look at my photos at even 30 and now 40, I'm much better and in good shape. And I love it. I've always wanted to wear that particular dress that way. When I was fat, I couldn't buy that dress, and I'm so happy.
Never
Yeah.
did
And
it.
there's nothing
Yeah.
wrong if I lost weight. There's nothing wrong if I, wanted to look good. in
Yeah,
the outfit.
exactly. So I
Yeah.
feel like the theory, the underlying thing behind all of this is, no matter what, you should always try and stay healthy to some extent. Like always improve.
So see, that's why it's not about losing weight.
Yeah.
That's another thing I'd
Exactly.
say. Okay, if someone is genuinely on the healthy side, having some hormonal disorders, this,
Yeah.
that, you must go get medical help.
Yeah.
Try to sort out your hormonal issues. Some people come to me and says, no, I'm not treating it, I'm taking Ayurveda. I mean, no offense. Something
She's
needs
taking shots.
some problems need allopathy.
Yeah,
it's
for
not.
sure.
I mean, and you need to in your mind know that you have to have a lifestyle when you
Correct.
have these issues.
But then
I know,
placebo plays a big
that-
part, no?
Huh?
Like your
Yeah, I wanna know
placebo
about
plays a
that.
huge part, right?
Yes, yes.
How does
So,
placebo work with these things? Like,
I don't know. I mean,
okay.
I'm not a
I'm sorry, I'm
psychiatrist.
treating you like
I'm not a
Google.
psychiatrist.
No, I really
I'm
feel
not
like
a
she's God.
counselor. I'm not. Like,
Yeah, yeah,
this
yeah.
is this much I know.
Right. No, but it's true, bro. Like the psychology of believing that the medicine will work helps you. Like the test was done, right? They
Yeah.
gave sugar tablets to somebody, telling them it was a headache tablet.
No,
Yeah.
but
And
we
then-
stopped halfway. I just want to clarify.
Yeah.
We could sound very vain. For some people, we are sounding very vain. Oh, just because I'm fat,
Yeah.
don't call me. I'm happy with my body.
Yeah.
That is one way to put it. But the other thing is, it's not about losing weight. Please learn to get fit.
Yeah.
Stay healthy.
Okay.
Yeah.
If you are a little, it doesn't matter. I know people who are a little bit on the heavy side, but run. Run. They are otherwise thing. If
20
you don't want to
minutes.
feel like you don't have to be skinny. That's
Right.
not the rule right
Yeah.
now. At least be fit.
Yeah.
And fitness
Good
is more
lifestyle.
important.
Yeah.
When
Yeah.
you start doing it, it just you'll start loving
Yeah,
it.
because like there's guys that are built like Greek gods, but like on the verge of a heart attack.
No, I can see.
Yeah.
There could be somebody
Yeah.
in my gym. Okay, example like who's probably much skinnier. A girl who's much skinnier than me, and she probably wears like body wise look
Yeah.
like every girl like, oh, she's so skinny and she's.
But she may think
I would say
something
I
else.
can lift more weights. I'm more muscular. I'm more athletic. Be happy with what you have, but not keep going for something. If it's achievable, fine. Not achievable to some extent, plastic surgery may help, but not to the entire extent.
Yeah.
Yeah.
Somewhere you have to put your efforts into whatever.
Yeah, because like I think like body positivity right now, it's like if you don't validate how I'm feeling, then you're not like you're I'm gonna
Correct.
cancel you.
No,
It's
I
like that.
don't believe in that.
No,
Yeah.
that's exactly
That's why, yeah.
that's the problem.
be-
Like I am beautiful
Try to
no
be-
matter
No matter what you think.
I do
Okay,
not
I mean, if
care.
you feel that, fine. But then sometimes you look yourself in the mirror. So something, this is. I don't know how my mom was very ahead of her time. My mother, she's no more, but
Okay.
I just lost her before I completed my plastic surgery.
Ah, okay.
And that unfortunate incident, but she was all for plastic surgery. I don't know how. I mean, she was way ahead of her generation.
Okay.
And she
Forward
always said, when I was to be plump, I used to be, no, I'm not buying that jeans. Way before taper or pencil pants came in, she used to tell me, because you're a little healthy side, you should wear this. She always said one thing. I was in that frame, like, I don't care the way I look, like, I don't care if boys don't look in.
Okay.
But she says, when you walk out of the house, once, just look at yourself in the mirror. Do you really think you are presentable? And she was one person who taught me. My mother
She
said,
cut the
just because it's in fashion, can you carry off that fashion? Are you comfortable in it? I never
Buzz.
wore a crop
Yeah, it
top.
is.
I never wore a crop top for years till I didn't feel I had the abs to work it. And maybe that's my mom. I don't know. My mom was on the heavy side.
Yeah.
But when she wore a sari, the way she would drape
She
it,
pull it off.
Yeah.
I mean,
Yeah.
and some people said, your mom is never fat. I said, oh, okay. But she said, it's the way, it's not because it's in fashion, you have to wear it.
It has
you
to suit
carrying
you.
It?
Like,
Are
yeah.
you carrying
Yeah.
it well?
Yeah.
So this is her telling me when I was in my 20s, and that always stays with me that I wear what I feel comfortable. Is it really looking good on me? Just look at yourself once when you
Bars.
walk out.
Bro, and
Buzz.
it's actually amazing.
That's bars.
There's
And
no,
this
that's
is
the-
not body shaming. This
It's
is not
not.
vanity. I don't know why
Yeah.
some people believe that is.
Yeah, it's
We're
because
characters.
because it's the way to cope, I think. To like
Well, yeah, let's not debate
Let's
it.
not debate that, yeah.
There are all kinds of people that make this world,
Yeah.
and everyone be happy.
Fair.
in
All functioning in their own way.
And function
Yeah.
whatever makes you happy. At the end of the day, we cannot debate.
Okay.
Portion.
Wait, let's do
Okay, go on.
let's do myths.
I want to talk about like how it is
Remove this.
from Bangalore to this thing and dating
Right.
and all that. I want to know.
Then cool. This is a quick fire segment.
Quick fire myth busting
with Dr.
segment.
K.
Okay, I'm ready.
Okay.
Coffee with current type.
Coffee
shit.
with Karan,
Coffee
rapid
with
fire.
Karan.
Oh yeah, this is exciting.
Hot
Okay.
seat.
Even I'll answer.
We have a hamper.
Okay.
Better have.
Skincare packaging doesn't matter.
Skincare?
Packaging doesn't matter.
It does matter.
Yeah. Most of us are answering.
I mean, you need to know the ingredients that you're putting on
Ingredients.
yourself.
No, I just see how.
No, I
good
feel like if it looks good,
Yeah.
if the packaging
Everything
looks
that
good,
looks
is it
good doesn't
Exactly.
Taste
So packaging
good or
doesn't
feel
matter. Yeah. So that means
even in
packaging-
So
all
what
the
if
other ways
I
in life.
just take like Dabur skin product?
Yeah,
Yeah,
but it has
the
good
spice-
ingredients.
Dabur is good ingredients.
Oh,
I'm sure you can
Shout out
put.
Dabur. Hit us
Dabur
up.
honey is good to eat.
Yeah.
fair,
yeah.
fair. Okay,
Next.
Never pop pimples.
No, you should.
Never.
Oh.
Never.
Never.
Pop pimples. They leave permanent scars. Hard to take off.
Wait,
So
what?
don't pop your pimple.
What
but
about
then
the
everyone's-
dirt that comes out? Like I never got that. Is that
No,
a
but
myth?
then, okay,
Like,
when it's
dirt-
ready to pop, you pop it, right?
No,
No, just-
because you're just pressing on it and you're creating that turns into a scar and it leaves
Don't.
pitted scars.
Listen,
Don't pop your
John.
pimple.
Please.
What do I do with the pimples?
Or go to a dermatologist because they have these
Pimple patch.
not a pimple patch, but maybe you have a blackhead or it's a pus. There's a way to extract your blackheads, whiteheads, and they will help you put something or some ointment on it to just sober it out.
Okay, if I'm at
Without
home,
leaving a scar.
Okay, but what's the correct way to pop pimple?
Don't.
Do not
Don't pop. What do you mean?
No,
Bro,
what's the correct
flick
way to
it.
deal with the pimple?
No, so if it has some, you see, there are different types of pimples. If it's pussing, definitely don't pop it. If it's just like a blackhead, whitehead popping out. In fact, the doctors, the dermatologists, rather than even salons, have their specialized those zit removers, and they
Okay.
gently take it off without leaving scarring.
What about ingrown hairs?
Ingrown hair, get laser hair reduction.
For an ingrown hair, like
On the face also,
Yeah.
for some guys who get it on the top part of the cheek, you keep removing it, it will keep coming.
Yeah.
You can burn it with a laser, so you have laser hair reduction.
I need this, bro.
So
Every
we
morning,
do for
just
men also for
get
like
off.
beard shaping, and they have fine hair. So we do laser reduction for many men also.
Oh,
for
so they
beard.
have a permanent shape.
yeah, like some.
Oh man.
Mad.
I've had like I used to get ingrown on my legs, and many years back before my clinic also 10 years back I started laser hair reduction for my entire body. I never for the last 10 years I've never waxed. So
Wait,
laser
so
reduction.
you got it like arm hair?
entire body, which means every area.
Damn.
I'm not going to specify.
Wait, hold on.
What about
even
Even
like
men do it.
Wait, but like
We do whole body men for
Once-
for
once,
men
like,
who are
everywhere?
really hairy who
Hey, I feel like we should.
Hey,
be
listen, I
hairy.
like my
if you like it, keep it. But there are a lot of my own friends who like, like
don't speak
were
about
like
body, yeah.
not
Can we reverse
comfortable.
it? I want to reverse
I mean,
it.
I have a friend, like, he was in Dubai and it gets very hot there and he was like really hairy. He's like, Karishma, should I go for it? I said, yeah. See, in men, you cannot completely get rid of hair like women because testosterone will keep
Yeah.
But I
giving.
don't think
But
there's
at
any
least instead of having very thick hair, he's like, at least now I have like a lighter hair. It doesn't like
Okay.
get fuzzy. So you have a problem with
Yeah,
it, do it. You
that's
are
what I
fine
thought.
with hair, so keep it.
Hey, but I feel like if
Yeah,
we take if men
It
who
never
wax
goes
their
completely.
men who wax their legs a little feminine, no?
Like bodybuilders do it for their competitions.
Yeah,
and
but
all.
then
bodybuilding fine, but
bodybuilder
like
fine, bro.
the Roman
Why do you want
Anish.
to wax it? Why do you want to wax it? Do laser.
No.
Do
This
laser.
is rapid
Dr.
fire.
Karishma, aesthetics.
I'm sorry.
Yeah.
Dr. Karishma, aesthetics.
Okay,
Laser.
Laser, next one.
Okay. Using sunscreen daily is too much.
Facts.
It is needed daily.
Oh
Please
my
put
God,
your
I'm-
sunscreen 20 minutes before you leave. Every single day.
Even Indians, because
20 to
Indians
30
have the
minutes
brownness,
because
right?
it takes that time
Can I
to
can I
act.
like replace that with my moisturizer? Like I don't need moisturizer.
No,
Right?
some moisturizers have sunscreen in it, so
SPF,
check.
yeah.
So check a good one, medicated one.
okay.
But so yeah, for many guys who don't want to use two things, they give a moisturizer with a sunscreen in it.
But sunscreen normally isn't like moisturizing. Like it doesn't.
Some sunscreen do have a moisturizing element to it.
Yeah.
Okay.
I use the same one for face.
This is rapid fire. Next.
The order of your skincare products doesn't matter.
It does matter.
How so?
Yeah, because the layering is important. So I will do my face wash in quick. Face wash. Maybe your serum, maybe vitamin C if you put it. Your moisturizer, sunscreen. That's it. My I'm talking about mine.
Moisturizer and sunscreen.
Vitamin C is an antioxidant and aging. Now I'm 40. Like, come on, I need to do
Bro,
some
don't look
anti-aging.
40 because she's
Thank
right in the
you.
right order.
Yeah, I was like,
It's the
'cause
right
you did-
order.
yeah.
I'm a plastic surgeon. It's a professional hazard.
Yeah. Fair
No,
enough.
but
Oh,
moisturizer,
is it detrimental
sunscreen
to your
morning,
job?
night. You put either a moisturizer or
Yeah.
for someone who has some anti-aging routine,
Okay.
they put certain things at night.
Right.
Yeah.
Next.
Enlarged pores can be reversed.
Rapid fire. Dr.
Can
K.
we go to plastic surgery questions because
Yeah,
you are
okay,
not
okay, fair,
asking
fair.
me.
Next.
Do you know what niacinamide?
You're again going skin. I'm not a dermatologist.
Yeah, these are all
keep
skin
it.
questions. Clean beauty is safer.
What is that? What's clean beauty?
Clean beauty is safer. Beauty is all should be clean. I mean, use
Dirty
use
beauty.
clean, use clean,
Hey, dirty okay.
clean and safe beauty products.
Yeah.
You know,
Okay.
see what is at the back in the label. You
But
know,
some people have
fragrance
homeless
free,
risks.
paraben free, sulfate free. That is the new
Okay.
trend.
Yeah. I feel like that's enough.
I have a last
Yeah.
one.
Okay, last myth.
How bad is cosmetic height surgery?
How bad is
Cosmetic
surgery.
height surgery.
Height surgery.
height surgery?
Height.
Cosmetic height. There is no cosmetic height surgery. I
There
can't do
is.
height.
There is.
Hey, no. There's like
There
I've seen
is.
clips
Yeah,
of people who take the bone
Yeah.
in the thigh and.
Orthopedic question. An orthopedic
okay.
surgeon should be answering this.
Okay.
I have a question.
Yeah.
Have men ever come to you for butt implants?
Yes.
Have men
What
ever-
really?
Okay.
Or fat transfer. Yes.
Have guys
So
ever come
we
for like?
now there are two aspects. There are some men who generally can't even buy a good pair of jeans and like everything falls
Yeah.
and it does look a little awkward to the rest of their body proportion.
Oh,
and I
okay.
have done fat transfer, not to make it look like a Kim Kardashian,
Like a
but
lovely
just
little
for a
bump.
man.
Lovely, yeah.
There have been men who have unwanted fat, which is very unusual genetic hip fat, which makes them look feminine, and have removed it, to make them look, slimmer like a male's profile. And then obviously I have a lot of my transgender patients
Yeah.
Okay.
who are male to female or doing a transition female to male. So those who are doing male to female gender reassignment surgery, they do come to want to have a body which is feminine.
Oh, so people who transition come to you.
Yes, I do gender reassignment surgery.
Oh.
You do?
Yeah, that's part of plastic surgery.
Mad.
Idiot, bro. Why is he so surprised?
I mean, yeah.
That's crazy.
Yeah,
I
yeah.
thought it was just like
I thought it was just like Botox.
yeah.
No. So Botox can be done by a dermatologist as well as a plastic
Really?
surgeon. That is
Right.
something. Botox and fillers are not surgical.
Mm.
See, anything which is, like you're doing on the patient, which is permanent, is surgery, which is plastic surgery.
Right.
Skin, Botox, fillers, or any of the skin things that you were talking about is something which is repetitive. It, you do maintenance, and skin is lifelong. No, it's
Okay.
not. It's like surgery can be permanent, but anything non-surgical is consistent in maintenance.
I feel like if we're talking about like, because you've done this for like a very long time, right?
Wow, Ken.
But like, what?
Continue.
No, but like I'm just saying, like the whole, okay, you come in, get your
More than 10 years of experience.
get your surgery done and everything, and then you have to like constantly keep working out, right? Like till
What's wrong in that to maintain?
That's I feel like a lot of people, because of their circumstance, it's a lot of pressure. In the sense they don't have the time to do it, or they don't have the resources
so
to do it.
sometimes that is why some of them do sometimes liposuction or some things. And I've realized once they're there, all they have to do is maintain that. Some of them are already a good BMI, already in good shape, have that, as I said, the little areas which just they want to
Stubborn
just get rid of
areas.
it. For them, they are the ideal candidates for liposuction. Those with good BMI, good skin tone,
Okay.
already exercising, dieting, just want to get rid of those stubborn areas not going with all the diet and exercise.
Okay.
This is the ideal candidate for
It's like you have to be
liposuction.
as healthy
So they
as
just
possible.
have to, they already have a routine in place. Whatever I do just gives them that extra
Yeah.
10%.
It's like a nitrous boost.
And they just maintain it. And it's not that, you lose shape if you put on few kgs. That is, it's very difficult to put on fat in the area that we've done lipo.
Okay.
It could be, you really have to let go of yourself, put on
Really?
like 8-10 kgs and,
Okay.
then obviously, your body's going to decide where to...
Come on, let's
store it
go
like
and get stuff.
Like what, this empty place, bro?
Yes.
Come on, put the fat there, bro.
Push it
What
there.
are you doing?
But I feel like, you know what? Now let's get into something that is more general.
Okay.
Okay, because we've been talking about, cosmetic surgery, we spoke
Yeah.
about skin.
Yes.
Now let's talk about something more general, because
Yes.
I want to get to that side of your head also. Let's
Oh.
talk about the culture things in Bangalore, and let's also talk about dating, like the dating scene. Okay?
Okay.
Yeah.
Okay.
What's your scene right now?
I'm single.
Bro just wanted to know whether she was single
I was
or
like,
not.
are you hitting on me?
Cameras are off. What's your scene right now?
I'm single.
Okay, so let's get into the mentality. So, okay, is it because of choice, or is it because you haven't found somebody good enough?
Someone who meets your...
Presently, I'm so in love with my work.
Yeah.
And it's a big responsibility. When I started, we're going to complete 5 years to my clinic as of next month.
Damn.
Okay.
And when I started, number one, there was not a single female plastic surgeon who had a private daycare center in the city or even the state. It was challenged because I had to, all the plastic surgeons were male and very respected seniors of mine, and it was daunting to do this. So the moment I got into it, it is right now the focus in my life. And as a surgeon, whether male or female, it's now this is 40 to 50. I have 10 to 11 years of experience on my back.
Yeah.
But it's at the 40 to 50 which are our golden years, where we really have to aim. And as a person, I've always been profession as my passion, and that's always been
Okay.
number one.
Okay.
Right now, I've just not found anybody. I mean, I have dated,
Right.
I have been married, and
Right.
I'm divorced,
Right.
and to whatever circumstances, mutual. But I never backed out from this,
Okay.
from surgery.
Yeah, fair
that
enough.
always kept, and that's the one which always made me stronger and stronger.
Yeah, I mean, like, it's
And
a purpose, so,
Taking
yeah.
it was a purpose, and the purpose continues. I love what I do. If I don't have a day's work on a regular Monday to
Yeah,
Saturday, like if I don't and I don't do a surgery, I feel like there's something missing.
Yeah.
So I love my work, and it's not that, at this juncture of while I haven't found anybody.
So you're not too stressed about it, like...
I'm not at all.
yeah.
She's in love with her.
I am at I think the best peak of my career and
Yeah.
my love. I have fantastic friends who
Yeah. Maybe one day,
Damn, I have to wait till I'm 40.
No, one day a client
I
comes
don't
in.
know. I think things have changed. Before I thought at 30, okay, this will be. Now I realize 40 to 50. Now it's like I'm more
Yeah.
activated, and
Do you ever
and I don't believe in dating apps. So I
Yes,
thank God,
yes,
bro.
I
What?
am,
Oh my God.
I'm not in a single dating
Dating
app.
apps.
Dating
No,
app. Oh,
I
thank God.
personally am old-fashioned,
Organic,
organic.
Yes,
I would
yes,
rather
yes.
have a guy just walk across and have the confidence to talk to me.
Yeah. Okay. Let's get into that. What's the best way for a guy to like walk up?
Approach.
Yeah. This is for the 30% of men.
This is definitely...
for you.
Yeah,
you
this is
16-year-old.
definitely a cosmetology question.
Yeah. No, because I
didn't know
feel like
this.
the guys have been watching like shit, boy, I want to get bicep surgery and all that, but instead of that,
Learn how to approach, bro.
Learn how to
Come on.
approach.
Turning
I
into date
think
right now.
be yourself. Just walk across that
See,
room.
that's
be-
very generic, doctor.
Yeah.
No, you're sitting over
I
here.
don't know. I'm old-fashioned. Yeah.
It's like I'm looking. Like if I look at you across the room, I'd be like, that is way too intimidating.
No, she's there. Okay, I'm myself.
Be
Nothing happens.
yourself. Walk across with confidence.
Yeah.
And hey, you know what? I like you, or I think you're pretty.
Uh-huh.
Can I buy you a drink?
Can
Okay,
I
if
do-
I'm having a cup of coffee, can I join you?
Right.
Can I join
Yeah.
you?
Okay, pretend to be having a cup of coffee. Ken, go for it.
Oh,
Okay.
Okay,
Okay.
go on.
Bro, she's like really pretty.
She's already.
I think I should.
okay, I can hear you. And
Okay.
you're
No, wait. It's a scene building.
okay.
We're building it up, but like,
We're
you
building
think
it
she's
up.
on my
Maybe we're
league?
just two friends,
Yeah, we're just-
talking. And,
So you think I can't ask her out?
and we're like,
Let's
what's
see.
up? You know, how's the day going?
Excuse me, ma'am.
Yes.
Excuse me, ma'am.
You lost it right there. You lost it right there. It's disaster. Now that is
that's
what you
very
don't
bad.
see in life. You not to know what to do. Learn what
What
not to do.
Okay.
And that is what my
Yes.
boss taught me.
Okay.
Yes.
Different approach. Yo, shouty.
No. Okay, I'll do it.
That is when he's like, you know, I'm still the person you walk across. Say you're okay at a bar, whatever. Like,
Okay.
you know, I think you're pretty, and I would like to have a dance with you. Like, I'm still that person.
No, you should start with a good high. That's what
You're getting
A
slapped.
nice,
No, a good high.
Okay, tell me a good.
a nice high.
Okay,
you
watch.
know?
Okay, John's
No, wait. Let me.
No, you lost it.
No, John's better than Ken.
100%.
Okay.
John's better than Ken. I believe.
Check me out. Okay. Drink the coffee.
Drink the coffee.
Drink the coffee, okay? Excuse me.
Why?
Hey, wait.
Excuse me.
Shut up. Excuse me. Hi. I think you look
Hi.
really nice.
Thank you.
Pretty good? Was that pretty?
Thank you.
Pretty good,
Thank
right?
you.
All you.
Oh, what? No, you say okay, hi.
Okay, thank you.
Excuse me,
Yeah,
ma'am.
Then you carry on.
Yeah,
She
then
said,
you
excuse me, ma'am.
Or,
I was joking,
it
bro.
could be a lot of things. I've had a guy come and says, you know what? I've been noticing you all evening, and
Oh yeah.
I
No,
really,
that's.
I really like the way you
that's
dance.
That's
Or
a
I've been
creepy ass
noticing
thing
you
to
all
say.
evening.
No, it's not creepy. It's
That
like,
is.
No,
No,
you
no,
can
no,
say.
no.
You can
It's
say that.
not.
Right?
As I
If
said,
you're
I
handsome,
mean,
it's not.
Yeah, exactly.
you
That's the
point out
problem.
that what attracted you to that person.
Right.
So if I have approached a guy in where there's a coffee, I don't know.
How do you approach a guy?
Actually, I have a little ego about that. I prefer the guy approaching me.
Hey, no,
Fair enough,
even we
fair
prefer. Yeah.
Yeah.
It's
Even
like-
we prefer.
Again, a
I
little
prefer
old
guys
fashioned.
approaching me.
A little
Yeah.
old fashioned, but yeah, if the guy's like, you know what, I've just been noticing you for a while, and maybe I love what you're wearing, or I love your shoes, or
You know
you
what?
dance well. Can I dance with
But
you?
like,
guys,
I mean,
it's a good
we
tip.
don't
No.
love your shoes. Like, we do not care about your
No,
shoes.
you know what you
Then
should say.
don't approach. I mean, see what you have been.
No, I'm just telling you, like,
about the
mentally, we
person.
don't care about what
Dude,
you're wearing. We
dude.
care about you.
No, I'm telling you,
Yeah,
good tip,
yeah,
right? Good
whatever
tip.
it
Don't
is.
compliment the outfit. Compliment something that is permanent.
Your
Your eyes.
Your eyes.
Bro, eyes, I'm telling you. See, because dressed and all,
Oh,
okay,
yes.
she's dressed up and everything,
Yeah.
right? But you will catch
But
her
I
off guard if you do something like-
have once
have
walked
nice
up to a
ears.
guy saying, you know what, I don't know where this will go, but I really love your eyes.
Yeah.
And you
Yeah,
have
yeah.
a very, very nice smile.
Yeah. But
know?
do that because like outfit,
Yeah.
yeah, well, I'll change the shirt tomorrow, but my eyes are there.
Or like if you've been like you've heard you're standing next door like having a conversation, and maybe the conversation the girl was having is very interesting. You could just be
I like
like,
your
you know
voice.
what? No, I like your you were having this conversation. I find it
Yeah.
really interesting.
Oh yeah. But
Oh, I was just gonna be
No,
like,
dude,
no, the
voice-
reason I started with excuse me, ma'am, is because I was gonna say excuse
No,
me,
excuse
ma'am,
no.
I love
no,
you.
no.
God,
Excuse
No,
me,
okay,
ma'am,
I have a
love you.
question. Okay.
no, ma'am, she'll just walk off.
I have a
She's
question.
like, yeah, what do I want to know?
How much does like a man's voice play into your level of attraction towards?
Yeah, like imagine like
Oh.
he's a 10 on 10.
You know, like-
But he's like, Enna ma'am. You know?
Not happening.
No, like how much does it play?
A big.
Like, give me
big
like a percentage.
difference. Yeah, like hello,
I
100%.
think-
I mean,
100%.
a strong. I mean, I don't know, like a strong voice.
Yeah.
How do you percentage this? I don't
No,
know.
for me, it's like a good 60% of my attractiveness to
Really?
Yeah.
60?
1 second.
Yeah.
Hold.
Damn.
Okay.
How
And
do you,
40% is looks.
Yeah, no, not
It's
looks.
mainly
See, look.
about looks.
No, that's me both personality. I'd say like 30% personality.
See,
yeah.
looks
at it.
matter. For me, it's not like looks or
Looks is just the gate.
Looks is that's
Yeah.
what it's,
It's
like,
not
you
like,
enter the interview with
It
your
was
looks.
really funny.
Yeah.
I saw this reel of Rakhi Sawant the other day. I think it's one of the things in that house or whatever.
Yeah,
And you
okay.
know, the guy's like, he's ironing something. He's like, okay, so a guy who doesn't have six pack is of no good. She's like, no good. I mean in Hindi. And
Yeah,
nahi
yeah.
acha nahi hai. He's like, तो अगर six pack नहीं है वो तो guy ठीक नहीं है. She's like, समझ में नहीं आता लड़कियों को क्या पसंद है. अगर सिक्स पैक नहीं और बड़ा पेट है, क्या लड़की को बहुत प्रॉब्लम होगा मन.
I have
Just
no
kidding.
idea.
I didn't understand anything, by the way.
I'm a Hindi fail, by the way. I
No, but see,
cannot.
look at it this way, right? It's a
Yeah.
10 on 10
So
girl.
it's not that for me,
Uh-huh.
looks are not everything. Like I don't expect. I'm not like 100% perfect. I don't expect that he has to be, this tall, dark, handsome thing always. But for me,
Just tall and dark.
For me, it's that
Just
charm.
tall and dark.
It's that that
The charm,
there should be
charisma.
charm in the personality.
Yeah, yeah.
Something charming. The way they
Definitely.
talk, the way they dress and shoes.
Yeah.
For me,
Yeah.
the first thing I look at is
It's
the
like,
man's shoes.
yeah, like in this,
That's the same thing for me.
Let's
as
see,
well.
let's see. Ken, what do you wear?
Yeah.
I'm wearing
Yes,
Nike
sir,
flip flops.
Sneakers are good.
I'm wearing flip
A
flops.
good, no. So yeah, the voice,
Yeah.
just the charm about a person.
I feel like, yeah, the line doesn't matter. If you can't deliver it well, it's like,
No, I'm
And
telling
for
you,
me,
it's very bad.
I look at a confident guy.
Yeah, 100%. No, I'll tell you. So like, see,
You also look at a confident guy.
yeah, I do. No, so anyway, so
Yeah, if
see,
we feel like.
yeah. So here's the thing, right? There's a 10 on 10 girl in
Oh.
college. Okay, I found her extremely attractive. Okay.
Afzal,
Name drop.
No, she'll watch this because she's a big fan. of
Shahzad too.
Right. So I found her extremely attractive. Okay.
I feel like he's directly doing it through media.
Yeah. He wants to do it. He's doing it on
Cheap
purpose.
guy, man.
No,
Continue.
hear me
Oh
out,
yeah,
hear me
you have a way out. Why not?
Yeah.
out.
Cheap.
Yeah, facts. If you
I-
have a
I-
way,
The
take
doc,
it.
no, the
Thank
doctor
you,
can
thank
convince
you,
me.
thank
You're
you.
not convincing me.
Do it, John. Do it.
Okay, and I found her really attractive, okay?
Oh, yeah.
And I was waiting for the thing where, I'd finally go up and speak to her. And the day finally came, guys, okay? It was me, her, another one of my friends, and one of her friends.
Right.
So these two are engaged in a conversation, and she was there, and she started speaking to me. And out of her mouth, she was holding like this bowl of watermelon. She says, "Do you eat the seeds of the watermelon?"
She'll be like, yeah, shawty.
Wait, I want to talk about this topic. Have you seen those reels that
This
they'll
is
be like,
really bad.
no.
Not bad people.
No, look. You look amazing, right?
It's
But listen, so I'm just
You don't sound the greatest, honey.
No,
Like-
look, I thought I
It's a
glitched out.
personal thing. There could be
Yeah,
a guy who likes that.
Yeah,
voice.
Neha,
Yeah, there is-
obviously
no,
is like-
definitely,
Yeah,
definitely.
definitely. There's
What,
a
what,
market
what?
for everything.
Hello?
Listen, I have to be very politically correct here.
Look,
You
look,
guys
yeah.
can have
For
fun.
me, personally, I just didn't like it. So I thought I glitched out, okay. So I'm like, wait, okay, let me try again. I'm just like, yeah, I do eat the seeds, but then, I don't eat the seeds, but then in college I can't be caught lacking, so I'll spit the seeds out in college.
God.
And then she was like, yeah, that's why even I am eating it. And then I haven't spoken to her since.
Oh.
Girl, you're beautiful.
You look
are
amazing.
beautiful.
Your voice is
You are literally a model. You can't have me. You can't have me docking you. But then so for me it's like 60%.
I have no comments
No,
on
it's
this.
60%.
Yeah, please don't. Please
Don't say anything.
She
though.
said 100% though.
Yeah, you said 100%. So a 10
Yeah.
on 10 guy becomes a 0
Yeah,
on
how
10
are you?
doctor. How dare you?
This is not my field. This is not my field of.
Doctor said
Expertise.
100%.
I have no opinion on this.
Okay, but then, so my new question is,
New question.
you were a Sobo girl at one point, right? And we know the whole brand associated with a Sobo girl, and then you've come to Bangalore. Are dudes better in South Bombay or are dudes?
I heard they're
in
just better
Bangalore?
in Sobo, bro. Sobo, right?
I live in Bangalore. All my friends here are going to really.
Yeah,
It took me a while.
Huh? What?
But it took me a while to get adjusted to Bangalore. But at one point I was very like, oh, our South Bombay boys are the best, and like.
But then now you changed your mind.
Yeah,
Right?
as I'm staying here, and now the people and my friends, and it's changing.
It's changing. So Bangalore boys are becoming better. is what I
Okay,
said.
okay, I want to know this. The English accent in the north versus south.
Yeah.
Which one do you like?
Which do you like the Northy accent?
They speak English. They speak
They
very
speak
good
very
English,
good
but
English.
like it's in a different. It's in
The
an
tonality.
accent. There is, yeah.
Yeah.
It's
fine,
I'm
doctor,
going
it's
to be a
fine.
very bad politician's daughter here. That is
I
why
forgot
my
about
father
that.
said, don't take politics.
No,
I forgot about
it's
that.
fine. You see,
Okay.
the thing is, right now the guys won't mind. The girls.
I
will be like,
love
yeah,
my
straight.
I love my I like the accent. I would say in Bombay. I like the accent in Bangalore. And I was saying for 20 years the other day, someone said, I think you have this Bangalore accent. I don't know what that is.
It is.
Yeah,
You
even-
have a Bangalore accent.
Yeah.
What is that? What is
Just
that?
very good
Bangalore?
English.
Yeah.
Good English. But I'm from Bombay and I already had good English. I'm a Queen Marian.
See,
The likes of Shobha Day and Anil Dutt are from Queen Mary School.
I
and
know.
I carry the Marian foundation in
You
me.
do, right?
Yes.
So you have the foundation and everything, but it's just the andaz. The Bangalore, like they have that suave.
But when,
about
but
them.
Yeah,
I
I feel
still
like
have,
I still-
I still have people in Bangalore where I go and ask me, are you from Bombay or the North.
Could you have that twinge to you, Dad?
Yeah.
I mean,
No, I don't get that dark.
Yeah,
That
yeah,
I
the
have
dark-
not managed to get that
Hey,
dark. I've
we
tried my
tried,
best.
right.
We have the
I've
Joe's
tried
blood
my
in
best.
us.
Yeah.
Yeah,
That's why
see
Nas
that,
there.
you know, da macha, you know, that is not happening to me.
Wait.
What da macha?
Oh, I love it. I love it. I love it. I love it. I love
But
it.
it doesn't just come, you know, like, but sometimes with a couple of my friends, I
Yeah,
I
yeah.
do it and
Oh,
they're like,
I
please
do
stop.
Yeah, the matcha was a little forced. The da is fine.
Da-
Yeah,
No,
I feel like
that's
with like certain friend groups, I'm just like, no, like
No,
you know.
no. What the f***ing friend groups are those?
Wait, last question. Do you know what mewing is?
Mewing.
MEWING.
Oh, Shimon is here, by the way. Now, guess he wants
No,
to
I'm
put the
still
last
getting acclimatized to Gen Z terms.
Mewing is basically where you know this jawline part.
Ah.
They overtrade it.
know.
It's called-
You got
yeah, yeah,
it.
it's
So
like,
this is-
so when someone comes to you, just say shush.
Then look at the jawline.
Do it.
Do it. Okay, so.
Oh my God!
No, we got Dr. Karishma to view.
She's mewing. She's
Okay,
mewing.
okay, like that?
No. From the lips. From the
Okay.
lips.
Like, shh.
Oh my God!
God damn!
Let's go.
She's mewing.
Oh, she's
lovely.
20 now.
I love it.
No, it's this whole thing where you put your tongue on the
You
roof
gotta-
of your mouth.
Okay, wait. I'll
It's like you
show
overtrain
I'll
this.
show you how to do it. Okay.
Yeah.
Okay. So
Overtrain.
suck and spit 3
Okay,
times.
got it.
Suck it, spit 3 times. Okay.
She's mewing. She's mewing. Yeah. Look at that jawline, bro.
Bro,
That's
come
mewing,
on,
that's
come
mewing.
on.
That's crazy.
That's
Bro, okay,
mewing.
Shimon, do it. Just suck and spit 3
Get the
times.
best version of what I did, okay?
Yeah, 100%.
Okay,
100%.
Do it. Can you get
No,
that?
no.
Hey, we are not even
No,
going
no,
to
no.
the end of your
No.
jawline, man.
No, wait.
This,
Okay,
this.
I'll show you.
I'll show you. I'll show you.
We both do it to each other.
Am I doing it right?
Okay. You do me and I'll do you.
Okay.
Huh?
No.
No, you didn't finish the
I'm sorry.
jawline.
I'm
You're supposed to trace it.
You
Yeah,
trace
no,
your
I'll say-
jawline. And I know I have very
I'll
good
do it
jawline.
properly. I'll do it properly.
Bye bye.
Bye.
That is Undercity
Episode 35.
That was wonderful, guys. It was so nice to have a perfect Sunday afternoon.
Hey man,
Lovely.
now we're going to go to the bar.
Let's head.
I don't drink.
I'm
No,
taking
I'm
all
coming
of you
like
guys
right
out for
back.
a beer.
Let's go.
Let's go.
I'm
Subscribe.
not. I'm not.
No, I don't drink. I don't promote drinking. I'm a doctor.
Please tell my
Oh,
mom.
damn. No, you will later on.
I don't drink.
Please tell my mom.
Please subscribe. 70% use.
I do not subscribe drinking, but
Oh, no.
moderate
The channel is what I
alcohol
meant.
for everyone is okay.
Ma'am, can you please tell my mom I'm not drinking beer today?
Yeah.
He is not having beer. He's a
I'm
boy.
having iced tea.
Yeah.
No,
This is
lime.
latte.
Yeah.
Correct.
So
That's all
please
I've had.
subscribe. Thank you for watching and see you.
Thank you for bearing
Bye
with
bye.
this plastic surgeon. Thank you, guys. Thank you all.
Yes.
And thank you for bearing with this plastic surgeon for 2 more
Lovely,
hours.
lovely, lovely. Lovely to have you. Woo. Alright, GG's.
I got a black ski mask, but I don't ski, but I snowboard. Dash an MC off peak. If one of you try buy